How to complete the cardiovascular assessment. As always, we do our introduction. We knock, introduce ourselves, and explain what we're getting ready to do. With our cardiovascular assessment, it's very important to obtain the blood pressure, the pulse, respirations, and oxygen saturation. It's not only going to let us know how well the heart is working, it's going to let us know how well the heart is perfusing the blood. So are we perfusing oxygen to the extremities, etc.? We're going to auscultate the heart sounds. So again, we're listening for S1, S2. We're going to be trying to determine, is it a regular rhythm or irregular rhythm? If it is irregular, make sure that you listen for a full minute to obtain the rate. We're going to palpate the pulses on both sides. Again, we're listening for, or we're palpating to determine, is it regular? Is it equal on both sides? And what is the grade? Is it 0, which is absent, 1 plus, which is weak, 2 plus, which is normal, 3 plus, which is really strong, or 4 plus, which is just that really bounding pulse? We're identifying that capillary refill. Make sure you're getting all fingernails and all toenails, and all of them should be less than 3 seconds. If they have the fingernail polish on, make sure that you're pressing on the tip of the digit to get that blanching and then see how long it takes to return to its normal color. All of these things are going to help identify how well our heart is circulating the blood in our body. We then need to assess pain. Are they having any chest pain? And their pain could be described as pressure or tightness. It may be a sharp pain, a dull pain, an achy pain, etc. We're also going to assess the skin color. We need to know what color those mucous membranes are. We can also look at the nail beds. We're looking for pink, pale pink, cyanotic, mottling, etc. We need to determine the temperature of the skin. Is it hot, warm, cool, or cold? If it's cold, then we're not getting blood flow to that area. That blood is going to warm up the skin, so if it's cold, there is no blood flow. If it's pale or cyanotic in color, again, we're not getting blood flow to that area. It is going to be decreased. We're looking at the legs, especially, to determine the hair growth. Do we have adequate hair growth? Is it shaven? A lot of women and some men will shave their legs, but you can usually feel that stubble. Is it thick? Is it moderate, or is it sparse or thin? We're checking for edema. And remember, if there's no edema, that's going to be negative or none. But then we need to know, if they do have edema, is it pitting or non-pitting? The best place to check for edema is going to be on the shin. So along the fibula, or I'm sorry, the tibia, not the fibula. We need to determine, can we indent that edema? If we can indent it, then it's pitting. And then you need to assign the grade to it. Is it 1 plus, 2 plus, 3 plus, or 4 plus? Is it that brawny edema? If edema is present, then we also need to know the level. How high does it go? When we're done with that, then we do our closure. We're asking if there are any questions, and we're asking if the client has any needs. Making sure that the bed is in the low position, the bedside table is at their or within reach, call light is within reach, the upper bed rails are up if necessary, etc. If something is, some of these things are completed on the basic bedside assessment. You do not have to do them twice. You only have to do them once. This checklist is to just show you that these are the things that are necessary for the cardiac or cardiovascular assessment. So the basic bedside assessment does include some of these assessments. Again, you don't need to do them twice. You only need to do them once.